Hi, my name is NClark. I'm going to do my assessment on my geriatric patient. I'm going to let her give me permission.
You have my permission, Miss Clark.
Okay. This is Miss... What's your name? Miss Gero. And your date of birth?
August 23rd, 1953.
Okay. Alright, we're going to get started. I'm going to start with the fall risk assessment. It's just an assessment that we do with elderly patients when they normally come into facilities. And we just kind of assess them and see if they're at risk for falls. And I don't really have to ask you much here. I can just, I can't ask you, do you know what today is?
I think it's March 18th, 19th.
Okay, and you know where you are?
I'm in Pelham, at home.
Okay, and you already told me your person, so she's alert and oriented. So we'll give her a 4 here. No, I think I'm supposed to do that backward. Give her a 0. Have you been? How's your mood been? Have you been in any depression or sadness?
Yeah, sometimes.
Sometimes.
Yeah, especially when I'm in a lot of pain.
Okay. So sometimes when with pain, I just put a note out beside it so we'll know. And going to the restroom, do you ever have times where you don't make it to the restroom?
Most of the time.
Most of the time. Bowels and bladder?
Sometimes.
So we'll give her a 1. And dizziness, do you ever get dizzy?
I do.
Sometimes. Another 1. And then she's a female, so she won't get a number for male. On your medications, do you take any seizure medications?
No. They give me medicine. They say it can be for seizure, but they give it to me for pain.
Is it Neurontin?
I take Neurontin.
Neurontin. Okay.
And I take some Balta.
Okay. So I put a 2 because those are kind of classified as anticonvulsants. And what about medicine for anxiety? Take any kind of medication for that?
I don't think.
Okay. Put a 0 there. Okay, when you're getting up from a chair, we'll just do this real quick. Can you stand up from that chair? Do you have trouble standing? Get to the standing position. Oh, you did good.
Whew.
Okay. On the rising, I just put a 1 because she did push up on the table a little bit to get up. And I'm going to add the scores. Total score is a 7. And it says a score of 5 or greater puts her at risk for fall. So she will be a fall risk in our facility.
I do fall.
Okay. And your pain. This here we got a little scale where you can rate your pain. I will ask you, since you're alert and oriented, we most likely can use this scale where you can tell us the number from 0 to 10. 0 is no pain. Midways will be moderate and 10 worse. How would you rate your pain?
Right, it's mom. Probably an 8.
An 8. And I'm using the numeric pain scale from 0 to 10. Okay. Where is your pain?
In my back, in my hip, in my shoulder.
And is it all the time or does it comes and go?
Pretty much all the time.
Ongoing.
That's deep.
Is it like a aching pain? Or?
I don't even know how to explain that.
Some people just tell me it just hurt.
It just hurt. They be asking me, say, but is it stabbing? I don't know. I'm just pain. I'm hurting.
Okay. And what do you take for pain?
I take Narco.
You know what milligram? Probably 10.
Mm-hmm.
Okay. And how often you take it?
3 times a day.
And does it seem to help you?
Sometimes. Especially like when I'm getting ready to lay down.
I'm just taking a few notes here so we can let the doctor know. Maybe he want to make some changes. But it seems like Miss Gilbert have pretty severe pain with it being at an 8 and it's ongoing. So that's most definitely something we could talk to the doctor about. And try to see if we can get some better pain control. Okay. And my last scale is a braiding scale. This scale is to assess pressure sores or risk for getting sores. I know you told me you take Neurontin, so you have some numbness and tingling, or do you ever not like feel your bottom? Do you lose feeling in your bottom, or you?
No, not really.
What about your feet?
Sometimes they ache.
Okay. Let me just put her name up here. I'm gonna put her initials. And today's date.
3.
What is the date?
19.
It's the 21st, right? 21st. Okay. So we'll put slightly limited on your sensory perception just because you have some neuropathy. And the what you have with your nerve pain,
yeah,
and it's like numbness and tingling. Are you diabetic?
Mm-hmm.
That's mostly with diabetics when they call it neuropathy, but they give you that Neurontin for that. Moisture, we already talked about that. So we're gonna put, is that just occasionally when you don't make it to the restroom?
That's most of the time at night.
Most of the time?
Mm-hmm.
So we'll put 2, most very moist, since it's mostly at night. So you can kind of make it in the daytime.
Mm-hmm.
Okay.
Sometimes I don't know.
Activity. We're gonna put you walk because you constantly going. You walk a lot. Mobility. We'll put slightly limited there because I seen you had to hold on to the table a bit. Sometimes you have to hold on to the furniture when you walk.
Yeah, sometimes I have to use my stick.
Oh, you got a cane?
Mm-hmm.
Is it a straight cane? Or you got 4 points on the bottom? Or just 1?
1.
Okay. So put straight cane. Nutrition, how your appetite, man?
I hardly ever have an appetite. I have to make myself eat.
Okay. So would you say you eat maybe 1 meal a day altogether, or less than that?
Well, I don't, pretty much I can go all day. I have to make myself eat because I know I have to take my meal.
Mm-hmm.
And if I don't eat, my sugar will bottom out.
Yeah.
And so, therefore, what I do is I'll force myself to eat something because I know I got to take my meal to keep my sugar from going too high or too low.
Okay. So we'll just.
But I don't have.
Do you take like supplements like Ensure or Boost or something like that? No. So there, I'll probably put inadequate. We'll just have to work on that. Maybe we might need to add a supplement if you're not getting enough. But that's good, you know, about your blood sugar. You keep intact with that. How often do you check your blood sugar?
at least twice a day. But I'm supposed to check it 3 times a day.
And it stays pretty regular.
Sometimes.
I'm gonna just make a note that you've been having decreased appetite. And do you have any sores anywhere on your body? Like on your bottom?
No.
No. She got up pretty good from the chair, although she did use the furniture, but I don't think it's a problem right now with the friction. So I'm gonna give her a 3 that says no apparent problem. And I'm gonna add my scores up. 17. Score 17 has put her at risk for pressure sores, but it's a low risk right now. So we'll just monitor that area too. That's my assessment with Miss Gilbert. You got any questions or comments about anything?
I have a question. Since I have that area on my, I was talking about earlier, right here, like right here.
Yeah.
Could that be from that I can trying to get a sore or something up under my skin?
Is it like a knot or?
Yeah, and it hurts real bad.
Sometimes it can be. That may be something we need to look at. After I get through with the paperwork, we can go and look at that skin assessment, and we can let the doctor know, because they have something called a deep tissue injury, and I would need to look at it and just assess it and make sure it's not. But we definitely can look at it, and we may can put like a pad there for protection, just to make sure nothing's trying to break down. We don't need that, because when you're diabetic, there can be more problems when you get pressure sores. But we'll just keep an eye out for it.
Because I used to fall a lot.
I'm going to go and look at your skin in just a few. Okay, you got any more questions?
No, I don't think I do.
All right, well, thank you so much. And I'll be letting the doctor know, and we're going to go and get your assessment in just a few minutes, okay?
Okay.
Thank you.
Thank you.